ability to change people's lives relatively rapidly drew me toward orthopedic surgery. The patients and the mission have kept me energized. And it can be anybody from a Boston College varsity football or hockey player to an octogenarian who's playing pickleball. And I just love helping people get back to do what they used to do and the things they love to do. There was a national search for the first chairman of orthopedic surgery at Newton-Wellesley Hospital. It was just a wonderful opportunity for an amazing healthcare system as well. When I came here in 2012, there were approximately 4,000 orthopedic surgical cases going on per year. Now we've more than doubled the volume, and we're seeing more patients than we have ever seen before. We really have the same offering as an academic medical center, but as here in the community, you don't have to drive downtown to get the care that you would get downtown. Newton-Wellesley has more of a family-friendly environment, and being able to provide access in the community to quality care for patients across the spectrum of musculoskeletal care is critically important. I have to give thanks to the entire team. It is a team of teams, and the leaders of those teams are just incredible. The Spine Center started about 10 years ago as a collaboration between the Massachusetts General Hospital, Newton-Wellesley, and Spaulding Rehabilitation. And we have a multidisciplinary clinic there. I think when people hear the word spine center, they immediately think, oh boy, I'm going to need spine surgery. In 90% of the cases, that's not what patients need. It's this multidisciplinary approach. And that approach starts by seeing a navigator who decides, after listening to you and examining you, which clinical pathway you should go down. We have physical therapy on site. We have pain management specialists. We also have behavioral medicine. And of course, we have spine surgeons as the last resort. I'm very proud of our sports medicine team. We are currently the team physicians for all of Boston College's 31 varsity teams, and that helps to drive us. But part of sports medicine is taking care of the weekend warriors as well, and the kids in high school and people at retirement communities. All of that is sports medicine, and that keeps us excited to do that every single day. There are physicians here who are sports medicine physicians who are not surgeons. They trained in family medicine and internal medicine. Then they did an extra year or two of training in sports medicine. And if you've ever had an injury or had an impairment, you realize what a change it is in your lifestyle. And we like to help them get back in the game. Here at 978 Webster Street on Route 9, we started the walk-in clinic on a shoestring budget, really as an extension of a sports medicine practice. And the idea was to provide access and convenience to patients, along with expert musculoskeletal care, and to be able to integrate those patients' care at a lower cost. When we opened those doors in 2021, we just hoped that we would see 1,000 patients for the first year. Well, lo and behold, the year went on and we ended up seeing 4,000 patients. Every year since then, we have nearly doubled the volume. This year, 14,000 patients will walk through the walk-in door for expert orthopedic care. And oh, by the way, we do all that in 64 minutes of lead time. We have now started other orthopedic walk-in clinics. One is at Boston Landing near the Celtics and Bruins practice facility. It's a wonderful patient experience. One goal is to build a women's sports medicine center. And what that means is seeing patients from teenage years for ACL care prevention all the way to octogenarians who may have bone density issues. And the idea is across the spectrum to treat women's sports and women's health differently. The Joint Center started about 15 years ago, and it's a collaboration between the Massachusetts General Hospital and Newton-Wellesley. And over time, the number of surgeons and the capability of the surgeons has grown. Hip and knee replacements is their entire focus. Many of them are world's experts. People come from all over the country to see them. As Wayne Gretzky said, we want to skate to where the puck is going to be, not to where it is now. And that is our goal. And there's going to be a significant increase in joint replacement in the next 20 years at all hospitals across America. We want to be able to serve patients in our communities, but we also want to make it full service. There are millions of people who live in between of having some arthritis and having some pain, but not yet needing a joint replacement. We want to be able to accommodate them and help them. Philanthropy started the Joint Center. In the continuation of philanthropy to expand that initial vision is going to be really critical in the future. And I see philanthropy really, especially with our vision of a joint preservation center, being very, very important. The idea of preservation is to create a center that can help all those patients who don't need a hip or knee replacement. Someday they may, but to help them now, to meet them where they are. There are so many unsolved problems in musculoskeletal care. Your joints are coated with cartilage. And from the day you're born, God gives you 3 millimeters of cartilage in most joints. And once you wear through that, you're down to bare bone. Is there a way to potentially reverse that wear and tear? Are there ways to replace cartilage? Are there intermediary things that we can do? The goal for the long term is to harness the energy of stem cells and platelet-rich plasma and molecular growth factors inside your body, and so that your body has the ability to heal itself or to potentially someday grow new cartilage. That science is at an infancy. And as that science grows, the ability to potentially someday avoid joint replacement is really exciting.